Have you heard that apple cider vinegar is a superfood? Are all these miraculous promises we see on social media really true? Can everyone use apple cider vinegar without risks? And the question that worries me most, do you know there's a specific time that can be extremely dangerous to consume this product? Many people are using apple cider vinegar completely wrong, in the wrong dose, at the wrong time, and even choosing the wrong type of vinegar. This can not only nullify all the benefits, but also cause serious health problems. You'll discover what the 3 benefits really proven by science are, what exact dose you should use, and especially which people should never consume apple cider vinegar. And before the end of this video, I'll reveal the secret about which specific type of vinegar you should buy, because most vinegars sold in supermarkets are useless when it comes to health. You'll be surprised by information that can literally save your life. My name is Kenji Oshiro, and this is Global Health Guide, where we bring only information based on scientific evidence. If you're new here, subscribe to the channel because all our content is backed by serious research and real data. Let's start by destroying the biggest myth about apple cider vinegar. No, it's not miraculous. Nothing in medicine is miraculous. But this doesn't mean it doesn't have real, scientifically proven benefits. In fact, there are 3 major benefits that have a solid scientific foundation, and I'll explain each one of them now. The first proven benefit is blood pressure control. 60% of people over 50 have hypertension, and maybe you're one of them, or have a family predisposition to develop high blood pressure. Here's a fact that will shock you. Our ancestors before the 60s had a 1-to-1 ratio between sodium and potassium in their bodies. Today, with our processed and salt-filled diet, this ratio is 5-to-1, 5 times more sodium than potassium. This imbalance overloads your heart, causes swelling, and dangerously elevates your blood pressure. Apple cider vinegar is extremely rich in potassium. When used in the correct dose, it helps rebalance this ratio, bringing it to 2 potassium to 1 sodium, much closer to what our body really needs. If you combine the correct use of apple cider vinegar with proper nutrition, hydration, and exercise, you can reach the ideal 1-to-1 ratio. This means naturally more controlled blood pressure. But attention, never stop your blood pressure medications without talking to your cardiologist. The second proven benefit is body weight control. Apple cider vinegar activates a hormone called leptin, which is responsible for the feeling of satiety. This hormone is produced in fat cells, but many people develop leptin resistance due to excessive calorie consumption over years. Result? You eat, and your brain takes time to receive the signal that you're already satisfied. Impressive North American studies showed that people who consumed apple cider vinegar for 45 days, just once a day at the correct dose, lost between 4 to 6 pounds without changing any other habits. Those who exercised lost between 12 to 16 pounds in the same period. This doesn't mean you should just take apple cider vinegar and ignore exercise and proper nutrition. It's a powerful aid, but it doesn't replace healthy habits. And even if you're already at your ideal weight, apple cider vinegar helps keep it stable. The third scientifically proven benefit is the prevention and control of type 2 diabetes. Here we need to understand how sugar works in our blood. When you consume carbohydrates, and this includes bread, rice, pasta, not just sweets, 50% turns into glucose in the bloodstream. If this glucose gets too high, you develop diabetes. Your pancreas produces insulin to take this sugar and put it inside cells, but many people develop insulin resistance. It's like the cells change their locks and insulin can no longer do its job. Apple cider vinegar helps prevent this insulin resistance, allowing your cells to absorb glucose properly. Studies show that correct use can reduce blood sugar levels by up to 40%. But again, if you already use diabetes medications, talk to your doctor before making any changes. Now comes the crucial part. Constant glucose spikes cause something called glycation. which is responsible for plaque formation in the arteries of the heart and brain, potentially causing heart attacks and strokes. It also causes liver fat and damages collagen in your joints and skin, leading to joint pain and premature aging. Before we continue, I need to warn you about who should not use apple cider vinegar at all. These contraindications are absolute and can save your life. First group, people with kidney problems. If you have creatinine above 1.6 or urea above 60, are on dialysis, or have any kidney problems, don't use apple cider vinegar without nephrologist approval. Remember I talked about potassium? The kidneys eliminate potassium from the body. If your kidneys don't function properly, potassium accumulates in the blood, causing a condition called hyperkalemia, which can lead to cardiac arrest and is very difficult to reverse. Second group, people with severe gastroesophageal reflux, second or third degree gastritis, advanced esophagitis, or gastric and duodenal ulcers. Apple cider vinegar is acetic acid, and putting more acid in an already inflamed digestive system can significantly worsen your condition. First, treat your digestive problems, then consider using it. Third group, people with severe dental problems or worn tooth enamel. The acid in vinegar can further corrode tooth enamel, causing sensitivity and permanent damage. Fourth group, people who use neurological medications for seizures, epilepsy, or narcolepsy. Apple cider vinegar can interfere with the absorption and effectiveness of these medications, either increasing or decreasing their effects, which is extremely dangerous. Now let's get to the part that can make all the difference. Which vinegar to use and in what dose. Write down this information because it's fundamental. The correct dose is 1 tablespoon of apple cider vinegar to 5 fluid ounces of water, or 2 tablespoons to 7 fluid ounces of water. Always start with once a day. You can take it at 11 in the morning, 1 hour before lunch, or at 5 in the afternoon. If you have obesity, severe hypertension, or uncontrolled diabetes, you can use it twice a day, at 11 in the morning and at 5 in the afternoon. After 30 days, if you want to increase to 2 tablespoons in 7 fluid ounces of water, you can, but never ever use pure vinegar. This can cause burns to the esophagus and stomach. And here comes the most dangerous mistake I see on social media. People recommending apple cider vinegar on an empty stomach in the morning. This is extremely harmful. In the morning, on an empty stomach, you should drink about 20 fluid ounces of water and wait 30 minutes before consuming any food. Putting acetic acid in the empty stomach, esophagus and duodenum can cause severe irritation and even ulcers. Now, about which vinegar to buy. The transparent and pretty vinegars from the supermarket don't serve medicinal purposes. You need organic, unfiltered, unpasteurized apple cider vinegar with acid concentration between 4 and 6%. This type of vinegar is usually a bit cloudy and may have sediment at the bottom of the bottle. This is normal and indicates you're buying the correct product. Look in natural product stores, organic markets, or the organic section of larger supermarkets. The cloudy appearance comes from the mother, which are beneficial bacteria and enzymes that form naturally during fermentation. It's exactly this mother that contains many of the bioactive compounds responsible for health benefits. Have you ever been in a situation where you tried using apple cider vinegar but didn't see results? You were probably using the wrong type or inadequate dose. It's important to understand that benefits don't appear overnight. It takes about 2 to 3 weeks of consistent use to start noticing changes in blood pressure, weight, and glycemic control. During these first weeks, keep a simple record. Note your blood pressure if you have a home device. Observe how you feel after meals. And if you're trying to lose weight, take weekly measurements instead of daily ones, as weight fluctuates naturally. An important tip about taste. Many people give up because they find it too strong. You can add a pinch of cinnamon powder or a few drops of liquid stevia to improve the flavor, but avoid sugar or honey, as this interferes with glycemic benefits. It's also crucial to take diluted vinegar with a straw to protect tooth enamel. After consuming, rinse your mouth with pure water and avoid brushing your teeth immediately. Wait at least 30 minutes before brushing. Now, I'll reveal information that's rarely shared about apple cider vinegar, including some dangerous myths circulating on the internet. First, let's demystify some false claims. There's no solid scientific evidence that apple cider vinegar improves sleep quality, treats skin problems like acne or eczema, or improves eye health. These claims circulate widely but lack adequate scientific backing. A particularly dangerous myth is using apple cider vinegar to treat intestinal parasites. This simply doesn't work. If you suspect worm infestation, you need appropriate antiparasitic medication prescribed by a doctor. Using apple cider vinegar for this is a waste of time and can delay necessary treatment. There's also no evidence that apple cider vinegar detoxifies the liver or eliminates toxins from the body. Your liver and kidneys do this naturally and very efficiently. Vinegar can support overall health but isn't a magical detoxifying agent. Another important point: some people report gastrointestinal discomfort when they start using apple cider vinegar. This can include mild heartburn, stomach discomfort, or changes in bowel movements. If this happens, reduce the dose by half and gradually increase over 2 weeks. If symptoms persist, stop using and consult a doctor. To maximize benefits, combine apple cider vinegar use with other healthy practices. Maintain a diet rich in vegetables, exercise regularly, sleep adequately, and manage stress. Vinegar is a powerful tool but works best as part of a healthy lifestyle. I'll now share 3 practical tips that can enhance apple cider vinegar benefits. First tip: always take before meals, never after. This optimizes the effect on blood sugar and increases satiety feeling. Second tip: keep vinegar refrigerated after opening. Although it doesn't spoil easily, refrigeration better preserves active compounds. Third tip: be consistent. It's better to use a smaller dose daily than larger doses sporadically. If you're taking medications for diabetes, high blood pressure, or heart problems, monitor your levels more frequently when starting apple cider vinegar. You may need medication dosage adjustments as your parameters improve, but this should always be done with medical supervision. An important observation about interactions: apple cider vinegar can potentiate the effects of diuretic and potassium-reducing medications. If you use these medications, medical supervision is even more crucial. For people who travel frequently, apple cider vinegar capsules can be a practical option, but make sure they're made with organic vinegar and in adequate concentration. Always read labels and prefer brands with organic certification. Now, about long-term results. Studies show that consistent apple cider vinegar use for 6 months can lead to significant improvements in metabolic health markers. This includes reduction of glycated hemoglobin in diabetics, improvement in lipid profile, and reduction in abdominal circumference. It's important to have realistic expectations. Apple cider vinegar isn't a quick fix for complex health problems. It's a support tool that, used correctly and consistently, can bring significant benefits over time. If you have autoimmune conditions like rheumatoid arthritis, lupus, or Crohn's disease, talk to your rheumatologist or gastroenterologist before using apple cider vinegar. Although generally safe, there may be specific considerations for your case. To finish, remember that apple cider vinegar quality makes all the difference. Invest in an organic, unfiltered, and unpasteurized product. It may cost a bit more, but you're investing in your health. One bottle lasts approximately 1 month if used according to recommendations. The most important thing is to understand that you're adding a powerful tool to your health arsenal. Use it wisely, consistently, and always with professional supervision when necessary. The benefits are real, scientifically proven, but require correct use and patience to manifest. Which of these pieces of information surprised you most? Have you tried using apple cider vinegar before? Tell us in the comments about your experience, or if you have any specific questions. Your participation enriches our community and helps other people with similar doubts. If this content was useful to you, like the video, share it with friends and family who could benefit from this information. Subscribe to Global Health Guide and activate notifications so you don't miss our next evidence-based content.